Well, thank you, everybody. And I'm going to be talking about the emotional aspects. I know Dr. Carrion was talking about the difficult anatomy. I'm going to talk about the difficult emotional aspects of things. So these are my disclosures. I am a consultant for both Boston Scientific and Coloplast. I do want to start with two facts. Number one, the cornerstone, penile prosthesis is the cornerstones for surgical management for the treatment of erectile dysfunction. Its overall satisfaction continues to be higher than any other treatment option that we have available besides a pill. And however, it can also lead to multiple avenues of dissatisfaction. And it was over a decade ago, 11 years ago, that God enlightened a group of experts, and they were able to identify the determinants of patient satisfaction versus dissatisfaction, as well as characteristics of difficult IPP patients. And they came up with a very good acronym called the cursed patient. We call it the cursed penis. And ever since that came up, we've heard that more than the 10 commandments that were provided to Moses. And let's talk about it. So the compulsive obsessive patient, the one with unrealistic expectations, those requiring revision surgery, those who are surgeon shopping, those who are entitled, and those who live in denial. So when I graduated residency and fellowship, I was reading through this, and every single course that I went to, they talked about the cursed patient. And what I thought was that ever since I was going to go see a patient, this was going to be coming up into my office. So now, 6 years later, after graduating, I opened my own practice. But however, do not be interrupted. Don't get confused with the glamour or the glamour of this office, because based on this criteria, this is what's showing up into my office, and based on this criteria, this is an outside view of our office. So what happens when I am or I wish to be an experienced implanter? Do I need to always avoid these patients? Because sometimes we might find ourselves in this cursed land looking for options to help take care of these patients. So should our approach for the cursed patient be different? What are the key steps that I can do to ensure a successful surgery and also patient satisfaction? Again, this is based on my opinion. There's not research. First of all, we need to define success. Is it the ability to complete an operation? Is it to have less complications? Is it lack of recurrence for the erectile dysfunction for the patient? Or is it just keeping them satisfied? We need to understand what are the things that we can fix. We can improve rigidity to the shaft. We can improve penile curvature. We can sometimes improve confidence and self-esteem for our patients, but there are several things that we cannot improve. We cannot improve hand dexterity, penile size, pain or sensation. We cannot get the penis back to where it was when he was 18 years old. We cannot improve glans engorgement, orgasm, or libido. We also need to understand our audience, because let's be honest, a patient who has erectile dysfunction is a patient who feels like a failure. And when they feel like a failure, even though their partner can be supportive and tell them, don't worry, papito, I still love you, they're still going to feel like a failure. And this is a patient who's going to go online, probably in the middle of the night, looking for answers. So what can we do? We can provide them with educational material. There's Well Prep, there's a Heart series, there's YouTube videos available. If you don't have your own content, there's multiple providers out there that are providing content. We have the Back Table Urology podcast, we have the Meet the Penis provided by Dr. Perito, the podcast. And again, we need to also understand our audience. How much does your patient know about the procedure? Is he adamant to get back when I was 20 years old? Do I need to spend more time with my patient? Let's talk about time, what I call the time-demanding patient. We need to identify which patient I will need to spend a little bit more time with. For example, a patient who's younger, I might probably need to spend more time than somebody who's older. This is, again, my experience. Somebody who's single might be more self-conscious about their anatomy. They don't want their partners to know what they're going through, versus somebody who's in a stable relationship. Somebody who has failed less treatment options. It's not the same conversation of a guy who's failing pills versus a guy who's failed pills, vacuum pump, injection therapy. Is there a presence of curvature versus no curvature? Patients which I call with extremes of knowledge. A patient who thinks they know a lot about this procedure versus somebody who has no clue. That's an opposite to somebody who has a healthy understanding of the surgery. And also the self-pay patient versus the insured patient. Why is that? This is the same car, Volvo XC90, but one car you're paying yourself, and the other car the company is provided to you. Which one are you going to be more concerned about? Probably the one that you're expensing yourself. So again, a patient who's paying out of pocket, make sure that you spend more time, a little bit more time with them. So I'm going to show you guys is an email of a patient that came from out of town. And just to give you an idea of how these patients can present. Hi, Dr. Clavell. Sorry for the late night emails. Again, this is 11 o'clock at night. But just one more before I see you on Wednesday. I've attached my recent erection photos from all angles. I've also listed the goals I would like to achieve from this surgery. Number 1, I want to be straight like an arrow. Number 2, I want to regain some girth because I've lost girth running down the full length of both sides. I want to maintain my length, which is approximately 7 inches. I want an invisible pump and minimal tubing. Please place the pump behind the testicles, minimal scar visibility, and what cracked me up was erection angle around 2:30 to 3 p.m. So for those of you that didn't understand, this is a clock, this is 12 o'clock, this is 3 o'clock, this is 2:30. So basically, this is his happy zone, and everything around that is an unhappy zone. So, and he also, on top of that, he wanted to be straight like an arrow, regain girth, 7 inches, invisible pump, minimal scar. And I'm like, sir, are you kidding me? And of course, I told him, say, hey, we need to talk. Fortunately, I told him, say, hey, man, this is like me going to a plastic surgeon and tell him, make me look like Brad Pitt. It's not going to happen. So setting patient expectations. These are things that you guys can take home. These are things that I tell my patients. I do not minimize risks or complications. I tell them there are risks with this surgery, the most common one being infection. There is a risk of mechanical failure. So again, if you live long enough, it will fail. In terms of size, I cannot make your penis the one it is today. You bring me an 18-wheeler, I get you an 18-wheeler. You bring me a Prius, you get in a Prius. I promise I will try to place the biggest one that your penis will tolerate, and I got this from one of Dr. Carrion's fellows. It's the penis that we need, not the one that we want. And it's also definitive. There is no going back from this. But remember, if they've used to failure, what are they going back to? Failure, this is probably going to be a good option for them. We also have to differentiate function versus cosmesis. Things will be different, but that does not mean it will be a bad different. You will feel the implant. Even though some companies market themselves as the most comfortable implant, there is nothing more comfortable than what God gave you. You will feel the implant. However, focus that it will work. However, there is a little bit of cosmesis involved when it comes to the surgery. And also defining success. What is your goal? Is it have spontaneity? Need something reliable? Do you want to know that you're able to perform? Do you want to have the hardest erection? Or do you want not to lose size? And Dr. Juan alluded to this. Vacuum pump. I'm not going to go into mechanics. He showed the data. But one thing that we need to define, though, whenever they're using that vacuum pump prior to surgery, is like define what's the visual length versus the functional length. Because many of our patients have that prepubic fat, and what they're looking inside the vacuum pump is not necessarily what they're going to see. There's a picture that a patient sent me. It's like, Doc, this is what I was before surgery, and this is what I'm after surgery. So I told him, yeah, so this is what you will see when you have the implant. However, this is what you will probably use when your partner is creating pressure against that prepubic fat. Also, what can we do in terms of like post-op? We talked about this, Dr. Juan talked about this, cycling, inflating and deflating that implant every day for at least 6 months, and also allow time, allow the body to heal. Because sometimes cycling, and we spoke about that yesterday during our lunch symposium, sometimes cycling can also help the patient focus on the experience that rather than his size. If you don't believe in this technique, let's look at this. 4 days post-op, patient send me these pictures. You can see 4 weeks post-op, the penis is already growing. There's still some swelling. This is him 6 months when he's not aroused, and this is him 8 months post-op, and it looks like a completely normal penis, right? So beyond the OR, what else can we do? Remember, this procedure is elective. The patient has very likely never been through this before, and this is a patient who will be anxious. So continue educating your patient and be available for them. So do we need to redefine the cursed patient, or should we restructure our approach? Should our approach for the cursed man be different? I would say yes, it should be different, but at the same time, not so much, because the cursed man is just a man with erectile dysfunction. Sometimes those cursed patients can sometimes become your happiest patients. Oh. Thank you.